Welcome to Life Happens, where Texans come to protect their legacy and prepare for the second half of life. Join your host, attorney Kim Hegwood with Hegwood Law Group, and our weekly guest as we navigate the challenges that emerge as life happens. Now here's your host, Kim Hegwood.
Hi, welcome to Life Happens with me, Kim Hegwood, and our special guest today is Alice Williams, and Alice is with the Seeley Center on Aging at UTMB. And so, Alice, real quick, tell me how long the Seeley Center on Aging has been at UTMB.
Seeley Center on Aging is originally started as a Pepper Center, which focuses on research for older adults. Over 20 years ago, I don't know exactly how long, but it's more than 20 years. And then the Seeley Center on Aging emerged out of that Pepper Center great original grant funding.
Perfect. Well, today we're going to be talking about something just a little different, and I think it's called D-Care. Is that correct?
That's right, the D-Care study.
And it's a dementia care study. And so what exactly is the D-Care study about? I mean, what are y'all studying?
In a nutshell, this is about improving care for people who have dementia, but it also includes providing support and resources for the caregivers. So that's the unique part about this study, is that it approaches what we call the dyad, which is those two people that are most affected by the dementia diagnosis.
And as far as who are you looking for this study? Are you looking for people who have been diagnosed with dementia? Are you looking for caregivers? Are you looking for different stages? Tell us exactly who would qualify for this study.
Okay. First and foremost, right now the study is limited to patients who have a UTMB doctor. And that's because we need to have access to their medical record system. But any patient of a UTMB physician who wants to be in the study, as long as the doctor agrees to work with us, can be included. The patient has to have a diagnosis of some form of dementia. And that, as far as the stage, we really want to include people with all stages of dementia, because we want to get a really global picture of what it's like, as dementia, as we know, is a progressive disease. And so people's needs and situations change as the dementia progresses. So we're including people in very early stage to very late stage dementia. And then the caregiver has to be a person who is not paid to provide assistance and daily care, what we call most care in the study. That's the main requirement for the caregiver.
So I'm thinking those non-paid caregivers are going to be family.
Yes, typically they are, but there are some that aren't, amazingly enough.
Wow, that is amazing. And so what are the benefits of participating in this study?
Well, the benefits are different between the two people that are involved. For the caregiver, the primary benefits that we're offering is an actual participation in a program while they're in the study. And so that means they're going to gain resources and information for things such as support groups, helplines, just information about dementia and how to care for someone. And then depending on which of the three different programs they are in the study will determine if they get additional support and care to those resources and information. And then for the person who has the dementia diagnosis, whenever you have a caregiver who is informed and educated and confident in their caregiving, that's naturally going to trickle down and affect how that person with dementia is cared for. So it's going to improve their quality of life. It's going to hopefully give them more time to be at home. You know, a lot of people with dementia, they say, I don't want to leave my home. Yeah, and I think that's most of us, you know, we want to stay at home through the end of our life, if at all possible. And so one of the long-term goals of a project like this is that it will allow people to stay at home that much longer, because they'll have that support and information to do that.
Well, we find that most people want to stay at home, and two, I think the studies as well show that that you do better at home. That's why they send you from the hospital quicker, because you seem to heal faster.
Yeah.
I always figured it's because they woke you up all the time, that I needed a good night's sleep, so I needed to go home to get that. And so,
Yeah.
but I think I heard you say there were 3 different studies. Is that correct?
Well, there's 3 different, this is what's called a pragmatic trial. So it's different from a clinical trial in that we are not using any kind of medications. It doesn't change the care that they're already getting. This is in addition to the care that the patient's already receiving through their PCP through UTMB. So what happens is that there is an initial interview with the person with dementia and their caregiver together, where we ask them a series of questions about how do they think they're doing. We ask them some questions that use their memory, just to get a basic assessment of where they are in the dementia spectrum at that time. And then we ask the caregiver a series of questions about how they're doing. Now, these are all, very well-established questionnaires in the research field that look at caregiver stress and burden and measure it over time. After that initial interview, then the dyad is randomly assigned to one of 3 different programs. The first one is where our study team provides them with this packet of information, resources, local and national, that they can access. It just gives them that information to use as they wish. The second program that they might receive is where a care manager from the Alzheimer's Association in Houston. Now, these are master's level social workers, and they use a method from the Benjamin Rose Institute for community-based care. They provide telephone support and problem solving and resources over the course of the study for the caregiver. And then the third program is where a nurse practitioner who works exclusively with our study team, she's a geriatric nurse practitioner, she will provide more individualized assistance, support, and resources for the person with dementia and their caregiver throughout the course of this study. So they get one of those 3 programs by participating.
So is it possible to be in more than one?
No.
Oh, okay.
No.
I was like,
Because
gosh, that sounds so great. I'm like, I could do this.
I get that
and I could
question
do
a lot.
that.
Yeah.
I was like,
Well,
gosh.
and keeping in mind, this is a research project,
Yeah.
but through it, our hope is that no matter which of the programs they're in, that it's going to be helpful. Now, I can say the majority of people that participate in the study will either get the dementia care specialist approach or the care manager approach with the Alzheimer's Association. So when people are hesitant, I like to make sure and tell them that we're attempting to recruit over 538 dyads for this study. So it's a very large study, and it's a part of a larger national study that is funded through the National Institutes on Aging and PCORI. If you've ever heard of PCORI, they are person-centered research.
Mm-hmm.
So this is part of something bigger, but it's the first national trial of its kind. It's very unique in the way that we are carrying it out, working with the dyad. They're receiving some type of assistance and support no matter which part of the program. We call them arms of the study. Whichever one they're in, they're going to get something out of it.
Well, it does sound like no matter which program, they are getting some benefits. And so, so how do they enroll?
Well, first of all, like I said, they have to have a doctor that's a UTMB physician and who is willing to work with the study. If they already have a UTMB doctor in geriatrics, family medicine, neurology, those doctors are already on board and have agreed that any of their patients can be in the study and they'll work with us. We're also getting ready to work with some doctors in internal medicine and getting those blanket referrals from them. So if somebody would call me about the study, and I would just find out who their doctor is and I could let them know that immediately. But if their doctor is not currently in an agreement with our study group, we will contact them and let them know about it and see if they're willing to work with us. The biggest question or responsibility of the doctor is giving us access to the patient's information through the course of the study. It's 18 months long. But people can contact me directly. I'll be sharing my email and phone number during this. Can I share it now?
Sure.
So they can contact me. My name's Alice Williams. My email is alwilla@utmb.edu, or give me a call, 409-266-9647. And when a person contacts me, I will ask them a series of screening questions to see if they qualify and to give them, more details about what's expected of them. People say, well, I don't want to be a guinea pig. And I tell them, well, there's no needles involved, no medication. If you're willing to talk to someone about your journey as a caregiver and what it's like for you emotionally, sometimes physically, that's a lot of what this study is looking at.
So I heard you say that the study was 18 months long.
Correct.
And how much time during the week or daily that are you requiring these people to give you to participate in this study?
The 18-month study involves 4 interviews with our study team. So there's a group of us, and we're all UTMB employees. I want to make sure people know that. We're not calling from a call center, somewhere in South America. We are bona fide UTMB research team members. And the first interview, the one where they enroll, takes place. And then within 2 weeks of that interview, they are notified of which program they've been assigned to in the study. And then depending on which program they're in will determine their contact level. For example, if they are in the program with the care management at the Alzheimer's Association, that's typically a monthly call. But they can also have access to that person more often if they need it. So they have some control over how much contact there is. Then at 3 months, 6 months, 12 months, and 18 months, our study team member will call them with some follow-up questions to the caregiver about how they're doing. The person with the dementia diagnosis is only involved in an interview at the first interview and the very last one at 18 months. So it varies depending on which program they're in. And we tell them, we work with the caregiver schedule. We have a lot of working caregivers, families that are piecing this caregiving journey together. So we make evening calls, weekend calls, early morning calls. We want it to be convenient and what's best for them.
So what are the outcomes? What are you looking to determine that's going to help seniors that have been diagnosed with dementia? What's the goal, or what's the hypothesis? Since we're doing studies, that's a word I haven't used in a long time.
Yeah, there you go. That's a little research term there. But overall, the goal is we're comparing these 3 programs, not by our own assumptions, but what people who are really experiencing them in real time, in the real world, in real situations, they tell us, this is what this particular program did for me. Yes, it helped relieve my stress, my burden, my psychological issues I was having. We do measures of depression. That's all included with these questionnaires. So when you can measure that over time and see either a positive change, a negative change, or no change, that's what will help us say, okay, this particular approach really worked with this group, or this one didn't. And that's what we're looking for, because the next step would be, with the outcomes, whatever those may be, to move forward and say, okay, this is what we found, what works. When it's this type of program, it's the most effective. And so let's look at getting those kind of programs in place in medical centers and outpatient programs, and being able to tell these clinicians, this is what really works. So, it's an on the ground kind of study. But that's the overall goal. And then, of course, there's, secondary measures looking at reimbursement. Reimbursement is the key to getting good care. And so part of the study is working, looking at Medicare coding and billing of what they will pay for that's provided in the study and what would continue to be paid for, or what we can convince them is, effective enough that Medicare should be covering it. That's a long-term goal of the study also.
I would think that most people don't know what Medicare does cover, so that they don't know to ask their primary care physician, can I get this? I need this. My family member needs this. And so I think just having that information sometimes, no matter whether it's a dementia diagnosis or not, is huge.
Oh, yeah.
As far as, what can I get? Because, I know from experience from taking care of my grandparents, I know that they'll send physical therapy to the house. I know they'll send occupational therapy to the house. I know that they will send, the nurse to go check on them if necessary and things like that. But, if there's more things, then there's a lot of things that we don't know. So I think that's good information to be able to tell somebody, hey, here's a list of things that you're eligible to have if you meet the criteria, and two, I guess the question becomes is how informed are doctors of knowing what Medicare will pay for? Because I would think that may be an issue as well, because we know the rules change all the time. But so I would think educating the physicians as well as the patients would probably be a really good thing as well. Do you find that that's helpful in what you're doing?
Oh, absolutely. Because this model, especially, I'm echoing a little bit. I'm going to turn down my sound a little bit. Is that better? So with this study, that's part of it too, is talking to the physicians about for example, the dementia care specialist arm of this study could potentially be covered by Medicare, where you would have a dementia care specialist who's either a master's level social worker or a nurse practitioner that's out in the community, providing this type of care. And, at this time, that doesn't really exist because somebody has to pay for it. We have a great house calls program at UTMB that provides tremendous care for people in the community, going to their homes. They go to assisted living facilities. And, for people that can't get out and make it to a doctor's office. And that currently is covered by Medicare. But again, like you said, a lot of people don't even know to ask for it.
Yeah.
I'll talk to people and I'll say, well, if your mom has that much trouble, I see you haven't been to the doctor in like 2 years. But they'll say, well, getting mom out of the house is almost impossible. Well, did you know we have a house calls program? Yeah. And that's a very good example. And, things like this, getting out in the community and letting people know what the question even is to ask. Sometimes caregivers say, I don't even know what the questions are, and to let them know that people like myself and our social workers and care managers and nurse practitioners in the clinics, in the inpatient programs, we're available. Just say, can I talk to a social worker? Can I talk to a care manager? Because we can help guide people through what the questions are. And I've talked to a lot of families through the course of talking to people about this study. And I realize, we take it for granted because I work in healthcare. So of course I know what's available out there. I talk about it every day. I work with the people that do it, but the average patient and caregiver a lot of times doesn't really know what's available. And when I ask them, did you ask for example, a social work consult at your last clinic visit? They'll say, is there a social worker at the clinic? And every clinic has a care manager or social worker. Even if they're not right there at that time, the doctor can refer them and they will, contact them either at the appointment or at another time. That's just one quick example. So.
Well, I think that's great because I think that medicine needs to be more than just seeing the doctor. I think that as a community, we have so many resources available and there's so many good people out there that can help, that really education, which is why we do the things that we do in my office, really educating the public on here's options you should have, so I'm super excited about your dementia care study. And
Thank you.
so where can someone find out more information? Do they get in touch with you? Is there a website? What's the plan?
All of the above. So if you're on the video, it's sharing my email again, but I'll give it to you again. It's alwilla@utmb.edu, or give me a call, 409-266-9647. Or just to find out more about the DCARE study, if you just want to give it a look over, there's a website dedicated to the study. And you can just Google this. It's DCARE, DCARE, study.org. All one word, dcarestudy.org. And that'll take you right to the website. It'll give you a review of these 3 different approaches. There you go. DCareStudy, STUDY.org.
So and spell it again.
Yeah. And it'll also tell you the other sites across the United States that are participating in this study. Thank you. And more about who our team is. This study is led by researchers at UCLA in California, who are well known for their dementia care programs and outreach. And they've set a standard of care and a model of care that we hope will sweep the United States and the world. And DCARE is part of helping make that happen. That would be the dream.
There you go. And so most definitely. So Alice, thank you so much for coming on the show and sharing all this information, because it's such good information. And I'm hoping that you get some more people, for your study, because getting good care, especially taking care of our caregivers, is so important, to make sure that the family itself as a whole is taken care of. And so I really, really appreciate you being on the show today.
Thank you. It's my pleasure. And I also hope this is helpful to people. And in the future, I'll be glad to come back and tell you more about more of our research.
I look forward to that. And so most definitely. So, all right. Thank you so much.
You. My pleasure.
Thanks for tuning in to this week's episode of Life Happens with Kim Hegwood. Be sure to tune in every Thursday at 10 a.m. wherever you listen to your podcast as we navigate through the challenges that emerge as life happens. The content of this podcast does not establish an attorney-client relationship or constitute attorney-client privilege, legal, medical, financial, or any other professional advice.